Hi, everyone. I'm Dr. John Whyte, Chief Medical Officer at WebMD. Today, I want to talk about the relationship of the healthcare system to people of color and figure out what's really going on. So, to do this, I've asked Dr. Amir Abdul-Jabbar, an orthopedic surgeon based in Washington. Dr. Abdul-Jabbar, thanks for joining me.
Well, thank you very much for having me. It's a pleasure.
Now, your father, Kareem Abdul-Jabbar, wrote a piece in WebMD magazine recently, and I want to read you the headline. He says the healthcare system and everyday individuals have to do a better job to protect us. Our lives are at risk. Has the healthcare system failed people of color?
Well, I think there is a long history of kind of tenuous relationship between the healthcare system and people of color. There's extensive writing out there, but Black people in America were initially used as almost test subjects, kind of like lab rats, and it's very warranted to have people with a little bit of skepticism out there. But those times have come and gone, and we need to use the healthcare system to our advantage. And it's understandable to have a little bit of fear when entering the healthcare world, but at the same time, we do need to use it because it's the most important thing to our health and to our lives and to our futures.
But do people of color face discrimination and bias? We know there's high rates of hypertension, diabetes, heart disease. We know there's differential treatment when they go into the hospital. Are these differences in health because of access to the healthcare system? Or is it more about those social determinants of health? Access to fresh fruits and vegetables, the ability to exercise and walk in what we call the built environment and having parks in areas where we live. Where do you think the disconnect may be?
I think it's a combination of the two. Obviously, you can't point to one individual factor that's affecting people of color to make the healthcare disparities so great. The access that you said to healthcare is one thing. There's no question that there is discrimination within the healthcare system. Depending on the community that you come from, it can be ingrained in the culture of the area. There are a lot of instances of people of color coming in with very valid complaints and being kind of brushed off by healthcare workers. But at the same time, they're coming in a place of disadvantage in terms of healthy options for food, in terms of healthy environments, things like asthma, things like, ability to exercise. All of these things play a factor, and it's playing out in the discrepancies that you see every day in people of color versus kind of white Americans.
Well, let's follow up on that. COVID really has blown the lid and showing everyone the disparities that exist. Black men and women die at 6 times the rate of Caucasians when they get COVID. Does that make you angry?
Of course, it makes me angry, and it always has. But at the same time, that anger needs to be turned into something constructive. We would hope to see that the government and the healthcare systems would put some energy into directly addressing people of color because they are far disproportionately affected. Some of that does come from people living in closer quarters, being more more exposed to the virus because they're at front care line jobs. So all of these things are factors, but you would hope that one would directly reach into the places where the worst outcomes are seen and try to help there first. But that's just not how our healthcare system's built.
Dr. Regina Benjamin, a former U.S. Surgeon General, has often commented that the number of Black men in medical school has not changed much in 40 to 50 years. I'd love for you to tell the audience what has been your journey into medicine. You're a successful orthopedic surgeon, a very competitive specialty. What's been your journey, Dr. Abdul-Jabbar?
Well, I feel very fortunate that my father was very supportive of my pursuit of education. Although he was a very famous, very exceptional basketball player. He went to all 4 years of college. He graduated, and that was always very, very important to him. And he instilled that in us. So when other people might be out there having to get a job, I was interested in working when I was doing very well in college. And he really discouraged me from working in addition to working at college, because he said, if you have great grades, you can do anything you want, and I want you to focus on this. And that's an incredible, asset that I had that very few people have. So as a Black person, I'm mixed race, my mom's white, my father's Black, but there are very few of us in the healthcare system. And I think it comes from the fact that there are very few Black men in college. That's actually, some people have said that rate has gone down. So there are going to be very few people of color in medicine if there are very few people even getting to the college level.
What's been your experience in medicine? I interviewed a physician a few months ago, an African-American physician in New York, and he talked about that he wore his scrubs outside the hospital. We know you're not really supposed to do that, but he wore his scrubs outside the hospital in New York City because he said it was a protective shield against racism. And people treated him differently when they saw or assumed he was a doctor versus when he wasn't. Have you or your friends or other people that you know experienced that type of racism within the healthcare community, even as physicians?
Absolutely. I mean, it's America. Racism exists in this country, whether it's in patients, in coworkers, and superiors. You're always going to see it. Sometimes it's much more kind of covert rather than overt, because as doctors, we're very careful. But it can be subtle, but it's definitely present. Fortunately, I went to my training in Louisiana, in New Orleans, which is a very diverse city. But there is still racism there, but it was incredibly valuable to be able to, as a person of mixed race, be on both sides of that. I feel like that's one thing that I'm very fortunate that I'm kind of able to walk that line. But there's no question that racism exists in America. And you can look at any institution, whether it's a medical school, a hospital, the community outside of the hospital, racism clearly exists.
Your father talks about you in the article, and it's clear how proud he is of you and your brothers. And I love this line, though, that he says he can nag all of you to make sure he gets good health care. What does he nag you about?
He may think that it's nagging. For me, as a doctor, wanting to be there, he's been through many different issues with his health. Wanting to be there with him is not any sort of task or problem that he faces, he impresses upon me. But he feels that way. Nobody wants to be a burden. And he definitely, as we're all moving forward with our careers, he doesn't want to impose his own kind of healthcare issues on our time. So he may look at it as nagging, but I would never look at it that way, and it's never been a problem for me.
He talks about the importance of Black Lives Matter, the importance of making a difference and an impact. Tell us about your work as an orthopedic surgeon and how you're trying to address the issue of healthcare disparities.
I specialize in spine, so my field is a little bit focused. I don't have a primary care role where I think that it's a little bit more important. The people that come to me have usually very distinct issues. But I'm fortunate I work for a Swedish hospital where we don't have to worry about whether a patient has insurance, how much they can pay. A lot of that kind of may happen at the front door, where people that don't have good healthcare insurance might not even make it into the door to be able to see me. So I feel like that's a big plus for me, is being able to work in an institution where I don't have to put that discrimination on to people that need care. But at the same time, it's something that I feel like I can be helpful, because I have seen people of color that come into my office that have seen discrimination, felt like their complaints were not valid, and they felt like they were heard for the first time. So being able to listen to patients and address their problems with an open mind is something that I may have that other people may not have just because of the way they grew up.
There's some data that shows patients of color who receive care from physicians of color receive better care. Do you think that's true?
I think it's a two-way street. If a person comes into an office and is not trusting of the physician, they're not going to be honest about their lifestyle, their complaints, the truth about the things that may be afflicting them. And then it's also true of healthcare providers. You know, if we have preconceptions about people and we think that they may have some ulterior motive, we're not going to give them the best care. So I think it's absolutely true because, you know, if you come in and you feel more comfortable with your physician, that may be because they are also a person of color. If you're more honest, that's going to lead to a better outcome and a better healthcare experience.
What do you say to young Black men and women who might be in high school now, who aren't even considering being a doctor, becoming an orthopedic surgeon? What do you say to them?
Well, I would encourage everyone to pursue their dreams. You know, it was always a dream of mine. And at times it felt like it wasn't really possible. Becoming a physician, I think, is more about perseverance than being some sort of genius. We're kind of put up on a pedestal as being very highly intellectual and the smartest people there. And obviously it's a very rigorous training and it's challenging, but if you have the perseverance to pursue your dreams, then you can do whatever you want. And, you know, it may sound a little bit cliche, but it's very real. It was real for me. And I'm very happy with what I'm able to do with my life. I love my job. And if you're interested, then never write it off.
Well, Dr. Abdul-Jabbar, I want to thank you for sharing your insights for what you are doing to try to help address health disparities, as well as the inspiration that you're providing to young people to consider their dreams.
Well, thank you very much for having me. It was really a pleasure. And I just hope that, you know, we can move forward with this. And I really appreciate what you guys are doing to help try to move the needle. Even if it's a little bit, it makes a big difference to a patient out there who is not able to receive the care that they need.